To successfully implement and maintain the Hospital Corpsman Skills Basic program at your command, program managers and evaluators should all be aware of the policy set forth by the Bureau of Medicine and Surgery. These guidelines establish how to manage the HMSB program, determine who is allowed to evaluate a member, how to understand the performance checklist, how to administer proper remediation, and how to document evaluations. The primary method for the Hospital Corpsman Skills Basic evaluation is conducted during direct patient care. This may not be possible at every patient care facility, so commands are encouraged to be creative with the management of the program. Program managers may find it easier to assign 1 or 2 evaluators for every department and conduct the majority of evaluations at the department level. This approach to HMSB is the preferred method at larger facilities. Smaller commands will find it more efficient to conduct the HMSB evaluations as a command training event. These evaluations can occur periodically throughout a command training schedule, providing sufficient time and billets to allow corpsmen to comply with the instruction in a timely manner. Hospital Corpsman E5 and above and licensed healthcare professionals can conduct evaluations. However, program managers should choose highly qualified and exceptionally motivated individuals. They should be approachable, articulate, and confident. They should have experience in operational platforms, military treatment facilities, and be well-versed in the 5 tested areas. Finally, evaluators should have the time and flexibility to take on this task. HMSB evaluation is a commitment for which your command and Navy medicine as a whole will benefit. The Navy Medicine Professional Development Center has created the only authorized performance checklists, also known as PCLs. There are 5 PCLs, 1 for each of the 5 skills evaluated for HMSB. Evaluators and program managers should ensure they are using the official PCL with the Navy Medicine Professional Development Center logo on the top right-hand corner. At the top of each PCL is the name of the critical skill to be evaluated, an area to assert whether this is the student's initial evaluation or re-evaluation, and an area to denote the command. Students have a block to fill in their demographic information. Safety is paramount while conducting an HMSB evaluation, and safety precautions are not limited to the guidelines listed on the performance checklist. Evaluator assistance is when an evaluator feels the student needs to be prompted of a step, or if the student forgets a step and cannot proceed without the evaluator interjecting. Within each skill, only 3 assists are allowed, after which the evaluator cannot prompt the student. However, if the student comes across a step and asks a question, the evaluator should use their judgment to determine if the question is assistance or necessary guidance. For example, if a student asks, "Is my scene safe?" then answering is not considered evaluator assistance. The performance standard in all skills is graded as pass or fail. A member must complete a percentage of parts to a skill without missing a critical item, as notated by an asterisk. Some of these flagged items are steps that are critical to ensure safety of the member and their patient. Any failure to successfully complete a critical item will result in a failure of the test and require remediation. The condition for all the skills is designed to allow students to perform the task on a simulated patient, such as another corpsman, but some are appropriate for use during an actual patient interaction. Each PCL lists the minimum recommended equipment necessary to complete the skill properly and safely. Evaluators should ensure sufficient equipment is provided to the student before the evaluation begins. The content for each performance checklist is derived from the Emergency Care Manual or Brady Book, Mosby's Skills, and other resources used at the Basic Medical Technician Corpsman program. It's up to the program managers to provide remediation for any corpsman failing an exam, and are encouraged to use creative methods for guaranteeing success. A day-long course with slide deck presentations may provide the basic information, but long-term recollection is not likely. Weekly study sessions led by an evaluator or several short classes held over a few days will encourage participation and provide flexibility. Temporarily reassigning the member to a nursing floor or primary care setting for OJT is another avenue that commands should consider for remediation. If a member fails after appropriate remediation, the HMSB program manager should liaison with the member's chain of command to review the remediation process. If the remediation provided was adequate, it'll be documented in the member's service record, and it may result in removal from the rating. Ultimately, the recommendation to remove a sailor from the corpsman rating rests solely with the commanding officer. The Navy Medicine Learning Management System will serve as the documentation tool for the HMSB program. Use course identification number NMETC-15-HMSB-1.0. Commands are responsible for ensuring that appropriate staff are assigned the course in the learning management system. When assigning the course, it's recommended that commands utilize the assignment option, recurs based on previous completion date. The member is responsible to upload a scanned copy of the completed PCS. The learning management system will document course completion on the day the upload is completed. The contribution of program managers and evaluators of the HMSB program is critical to the success of the corpsmen assigned to their facility. It will ultimately enhance the delivery of world-class care to our patients. Thanks for watching.